The COVID-19 pandemic overshadowed and even worsened a deadly epidemic that touches so many of our lives.
Madeline O'Neill dives into how mental health issues, substance use, and overdoses are on the rise and how to navigate what the pandemic left behind. Maddie?
Well, a lot of the data and numbers we requested shows this increase in substance use issues. Statewide, opioid overdose deaths from heroin, prescription opioids, and synthetic opioids topped 1,000 for the first time ever in 2020. Preliminary numbers showing about 300 more people than the year before. Now, with the highest number coming in May of 2020. The pandemic, of course, was isolating for all of us, pushing some into new habits and others back into old ones.
I had a really bad life until moving up here.
It took a change of scenery.
I'm so happy they're coming out.
For Mineral Point's Sean Jaco's life to look a whole lot brighter.
Man, I never had friends like I have up here. I never want to see a kid have to go through what I go through.
When he was a kid, it was hard to see a way through the darkness.
My little brother's dad was extremely abusive.
Escaping that at 12 when he tried heroin for the first time, homeless in Atlanta. Getting into meth, spending 13 years in prison, all things that clouded his judgment, keeping him from his kids.
You know, I was choosing drugs over them. I hate saying that.
Sean loves talking about his recovery, giving talks since he got clean for his kids and came to Wisconsin.
It's not how hard you fall, it's how you bounce back.
Even making an unlikely friend.
When he was having a very tough time, a guy that's been in prison all his, a lot of his life, where did he come? He come up to see me.
Iowa County Jail Administrator Mike Peterson says EMS response to overdoses is steadily climbing. From a total of 8 in 2018 to 15 already this year.
It's scary.
Those don't represent deaths, but Sean came close.
You didn't have no one to talk to.
COVID-19, a dark cloud for many, hung especially heavy over people whose positive relationships kept them sober.
They just want you to sit at home and be lost in your own hell.
When Sean relapsed after his mother's death, he couldn't find an open meeting.
So I get high. And I overdose.
Worried he'd lose his family again,
Really?
He felt alone, but he's not. Sauk County data shows an increase in drug overdose deaths overall. State data shows Dane County opioid deaths jumped from 105 in 2019 to 123 in 2020. EMS are responding to more suspected opioid overdose calls too, with Dane County Emergency Management reporting a 23% increase in 2020. The administration of naloxone,
give it a squirt.
The overdose reversing drug that saved Sean's life, has been going up in the county since 2019 too.
The pandemic really worsened things considerably.
Dr. Mike Replinger says at UW Health, the average number of overdoses has gone up 15% each year for the past 4 years.
We need to get people connected to care, and a lot of clinics, as everyone knows, were shut down during the pandemic. There were virtual visits, maybe, if you were lucky.
While virtual options aren't for everyone.
I don't know how to do no telehealth or Zoom.
They're what organizations like Safe Communities in Madison were left with.
And we already were in the middle of an epidemic before the pandemic hit, so it was just like this whole big mountain that rose up.
Doing their best to climb that, peer recovery coaches are now working on a return of in-person services mixed with virtual options, which can improve accessibility.
As bad as it's been, there's still a lot of positive things that have come out of it.
Even with the pandemic receding, the opioid epidemic sits tall in its wake.
I can hardly jump on Facebook these days without seeing another person we lost in our community.
Program manager Tanya Craigie says with calls doubled, increased funding for resources is needed more than ever.
Our team here is getting slammed. People are struggling. The world is on fire.
That, along with decreased stigma.
Start treating people with dignity and respect.
And not thinking of substance use disorders as something to be kept in the shadows.
This is a chronic brain disease where the reward pathway of your brain is hijacked.
Even though timely resources can be tough to come by, especially rurally.
I died that night when I overdosed. And I have to wait now to get seen. That's right.
Sean is bouncing back.
It's way more rewarding than jabbing myself with a dirty-ass needle. Duh.
He's focusing on the bright points in life.
I'm on TV right now, and I'm not in a high-speed chase. That's amazing.
Able to see them clearly with his family by his side.
And absolutely loving it.
We're hearing from health experts and seeing this in the data too, that alcohol and other substance use went up in 2020 as well. And of course, there are other factors beyond the pandemic that play into this, one being opioid use was already a big concern. We're also seeing more fentanyl, or really strong opioid, resulting in the majority of opioid deaths. Now, we have a lot more data about this, and of course, plenty of resources to help out on channel3000.com. But in the meantime, the Dane County Behavioral Health Resource Center is a good place to start. We have the number listed on the bottom of the screen there.
He's got a great story to tell.
He absolutely does, and I'm so happy he was able to share it with us.
Yeah, we wish him the best moving forward. Maddie, thank you so much.
Thank you.